The doctor looked at me like I was lying. Like the pain radiating through my abdomen was something I was making up for attention. He said I should try Tylenol and maybe lose some weight. I said I could barely stand up straight. He said I was being dramatic. That was my first visit to the emergency room. By the fourth visit, when they finally believed me, it was almost too late. This is the story of how the medical system tried to kill me, and how I fought back to make sure it never happens to another Black woman again. Before we continue, I just want to say thank you for taking the time to hear my story. If you're comfortable, let me know where you're listening from in the comments below. Now, let me tell you my story. My name is Beverly Carter, and I'm 59 years old. I've lived in Richmond, Virginia my whole life. I worked for 35 years as an administrative assistant at a law firm downtown. Good job, good benefits, good insurance. Or so I thought. I raised 2 daughters by myself after my husband passed when they were young. I never missed a day of work unless I absolutely had to. I was the person who came in early, stayed late, never complained. Strong, reliable. That's what everyone called me. Strong Black woman. I wore that title like armor. And maybe that's part of the problem. The pain started in March of last year. It wasn't a little discomfort. It wasn't something I could ignore. It was sharp, stabbing, like someone was twisting a knife in my lower abdomen. It would come in waves. So intense I'd have to stop whatever I was doing and just breathe through it. At first, I thought maybe it was my period. I was going through some changes, at my age. But this was different. This was worse than anything I'd felt before. And it kept getting worse. I tried to push through it. I took ibuprofen. I used a heating pad. I told myself it would pass. Because that's what we do, right? We push through. We don't make a fuss. We don't want to be seen as weak or needy. But after 2 weeks, the pain wasn't passing. It was spreading, up into my back, down into my legs. I was exhausted all the time. I couldn't sleep. I couldn't eat without feeling nauseous. And the pain, it was constant now. A dull throb that would suddenly spike into something unbearable. My daughters noticed. They kept asking if I was okay. I kept saying I was fine. Until one morning, I collapsed at work. I was walking to the copy machine, and my legs just gave out. The pain hit me like a truck, so intense I couldn't see straight. My coworker Lisa found me on the floor, crying, unable to get up. She called 911. The ambulance took me to St. Mary's Hospital, the closest emergency room. I was in so much pain, I could barely speak. They put me on a gurney in a hallway. I waited for 3 hours before anyone examined me. When the doctor finally came, he was young, white. He didn't introduce himself. He just stood at the foot of my bed, looking at a clipboard, not at me. "What seems to be the problem?" he asked, his voice flat, like he was already bored. "I'm having severe abdominal pain," I said, trying to keep my voice steady, even though I wanted to scream. "It's been going on for 2 weeks, but today it got so bad I collapsed." He barely looked up. "When was your last bowel movement?" "Yesterday." "But that's not... Are you on your period?" "No, I'm 59. I haven't had a period in 2 years." "This is different. This is... Have you been under stress lately?" I stared at him. Stress. I was laying on a gurney in an emergency room because the pain in my body was so bad. I couldn't stand, and he was asking me about stress. "I'm in pain," I said, my voice rising. "Severe pain. I need help." He sighed, like I was inconveniencing him. Then he did the quickest physical exam I'd ever experienced. Pressed on my stomach for maybe 5 seconds, asked if it hurt. I said yes, everywhere. He wrote something on his clipboard. "Your vitals are stable," he said. "I think you're probably just constipated, or maybe you have some gas. I'm going to prescribe you some stool softeners and Tylenol. If the pain continues, follow up with your primary care doctor." Tylenol? I couldn't believe what I was hearing. "I've been taking Tylenol for 2 weeks. It doesn't help." Something is wrong. I can feel it. Mrs. Carter, he said. And his tone was different now, condescending, like he was talking to a child. I understand you're uncomfortable, but we've run your vitals and there's nothing indicating an emergency. Sometimes anxiety can manifest as physical pain. Have you considered that you might be having a panic attack? A panic attack. I was laying there, in the worst pain of my life, and he was telling me it was anxiety. I'm not anxious, I said through gritted teeth. I'm in pain. Real, physical pain. I'm going to give you a prescription for Tylenol and some information about managing stress, he said, already walking away. The nurse will be by with your discharge papers. I left that hospital feeling more than just physical pain. I felt dismissed, invisible, like my words meant nothing, but I told myself maybe he was right. Maybe I was overreacting. Maybe it was just stress, or something minor that would pass. It didn't pass. 2 weeks later, I was back in the emergency room. Different hospital this time. My daughter Rochelle drove me to VCU Medical Center. The pain was worse. I had started having chills and sweats. I'd lost 10 pounds because I couldn't keep food down. This time, they took me back faster. New doctor. Older woman, white, with gray hair and glasses. She seemed more thorough than the last one. She asked more questions. She pressed harder on my abdomen. I winced. She noticed. We're going to run some tests, she said. Blood work. Urine sample. We'll see what's going on. I felt a flicker of hope. Finally, someone was taking me seriously. But after the tests came back, she returned with the same expression as the first doctor. Skeptical. Your blood work shows some inflammation, she said. But nothing that indicates a serious emergency. Your white blood cell count is slightly elevated. But that could be from any number of things. A minor infection, maybe. What about the pain? I asked. What about the fact that I can't eat? I can't sleep. I'm losing weight. Have you been taking anything for the pain? Tylenol, like the last doctor told me. It doesn't work. She made a note. Well, I can't prescribe you anything stronger without more evidence of what's causing the pain. We don't want you to become dependent on pain medication. There it was. The unspoken accusation. She thought I was drug-seeking. I'm not asking for drugs, I said, my voice shaking. I'm asking for help. I'm asking you to figure out what's wrong with me. Mrs. Carter, I understand you're frustrated, but the tests we've run don't show anything that requires immediate intervention. My recommendation is that you follow up with a It could be IBS, or maybe endometriosis. But this isn't an emergency. I collapsed at work, I said, tears streaming down my face now. I can't function. How is this not an emergency? She didn't answer. She just handed me a piece of paper with a referral to a specialist and walked away. Rochelle was furious. Mom, this is wrong. They're not listening to you. I knew she was right. But what could I do? I wasn't a doctor. I didn't have the magic words to make them believe me. I made an appointment with the The earliest they could see me was 6 weeks away. 6 weeks. 6 more weeks of living in agony. Wondering what was wrong with my body. Feeling like I was going crazy. I tried to work. I tried to function. But the pain was consuming me. I started using a heating pad constantly. I stopped eating solid food because it made the pain worse. I lived on soup and crackers. My daughters were worried sick. Mom, you need to go back to the hospital. My younger daughter Shanice said, this isn't normal. They won't listen to me, I told her. They think I'm making it up. Then make them listen, she said. 4 weeks after my second DR visit, I woke up in the middle of the night in pain so severe I thought I was dying. It felt like my insides were being torn apart. I was sweating, shaking, vomiting. I couldn't breathe. Rochelle rushed me to the hospital again. Third time? Same hospital as the second visit, VCU Medical Center. This time, I was determined. I wasn't leaving until they figured out what was wrong. The ER was packed. I waited in the waiting room for 2 hours, doubled over in pain, while other people were called back before me. I watched a young white woman with a sprained ankle get seen immediately. I watched an older white man with chest pain get rushed to the back. Meanwhile, I sat there, barely conscious from the pain, invisible. When they finally took me back, it was a different doctor. Young Latino man. He looked tired. "What brings you in tonight, Mrs. Carter?" "This is my 3rd time in the ER, I said, my voice barely above a whisper. "I've been in severe abdominal pain for 2 months. Nobody will listen to me. Nobody will help me. Please, something is wrong. I know it." He looked at my chart. I could see the notes from my previous visits. "I see you were here a month ago. They ran tests." "Yes, they said everything was fine. But it's not fine. I'm getting worse." He pressed on my abdomen. I screamed. Actually screamed. The pain was so intense I couldn't control it. He pulled his hand back, his expression changing. "We're going to do a CT scan," he said, "right now." The CT scan took 30 minutes. I lay on that cold table, the machine worry around me, praying they'd find something, praying for proof that I wasn't crazy, that the pain was real. When the doctor came back, his face was grave. "Mrs. Carter," he said quietly, sitting down next to my bed, "you have a mass on your left ovary. A large one. We need to admit you immediately." The room spun. A mass. On my ovary. What kind of mass? I asked, though I already knew the answer from the look on his face. "We won't know for sure until we do a biopsy. But given the size and the symptoms you've been experiencing, we're concerned it could be ovarian cancer. You need surgery as soon as possible." Ovarian cancer. The words hit me like a physical blow. "How long?" I asked. "How long have I had this?" He looked at my chart again. Based on the size of the mass, I'd estimate at least 3 to 4 months. Maybe longer. 3 to 4 months. I'd been coming to hospitals for 2 months, begging for help, and they'd sent me home with Tylenol. Why didn't anyone find this before? My voice was shaking. "I've been here twice. I've told them something was wrong." He didn't answer directly. He didn't have to. We both knew why. I was admitted that night. The next morning, a team of doctors came to my room. An oncologist, a surgeon, a whole group of people who suddenly cared about my pain now that they had proof. I wasn't making it up. The oncologist was an older black woman named Dr. Freeman. She pulled up a chair next to my bed and looked me in the eye. "Mrs. Carter," she said, "I've reviewed your case. I've looked at your previous visits. I want you to know that I believe what happened to you was wrong. You should have been taken seriously the first time." I started crying. Finally, someone was validating what I'd been feeling all along. "We're going to do a biopsy today," she continued. "And depending on what we find, you'll likely need surgery within the next few days. I'm not going to lie to you. This is serious. The mass is large, and you've been dealing with symptoms for months without treatment. But we're going to do everything we can." The biopsy confirmed it. Stage 3, ovarian cancer. It had spread beyond my ovary to my lymph nodes. If I had been diagnosed even a month earlier, I would have been stage 2. Maybe even stage 1. My prognosis would have been completely different. But because 3 different doctors didn't believe my pain was real, because they looked at me and saw a middle-black woman they assumed was exaggerating or drug-seeking, my cancer had time to grow and spread. I had surgery a week later. They removed both ovaries, my uterus, and several lymph nodes. The recovery was brutal, more painful than anything I'd experienced before, even the cancer itself. But I survived. The surgery was successful. I started chemotherapy a month later. 6 rounds, every 3 weeks, pumping poison into my body to kill whatever cancer cells were left. Chemo is hell. There's no other way to describe it. I lost my hair. I lost weight. I was so sick I couldn't leave the house most days. My daughters took turns staying with me, helping me through the worst of it. But I was alive, and I was angry. I was angry at the doctors who dismissed me. I was angry at a system that made me fight so hard just to be heard. I was angry that this happens to Black women every single day, and nobody talks about it. During one of my chemo sessions, I was sitting in the infusion center, hooked up to an IV, when another Black woman sat down in the chair next to me. She was younger than me, maybe in her 40s, with a scarf wrapped around her head. We started talking the way people do in chemo centers, bonding over our shared misery. She told me her story: breast cancer. She'd been going to her doctor for a year complaining about a lump. A year, they kept telling her it was probably a cyst, that she was fine, that she should stop worrying. By the time they finally did a mammogram, it was stage 3. Then another woman joined our conversation. Older, lung cancer. She'd been complaining about chest pain and shortness of breath for months. They told her it was asthma, gave her an inhaler, sent her home. It was stage 4 by the time they found it. 3 Black women, sitting in a chemo center, all with stories of being ignored, dismissed, not believed. All with cancers that could have been caught earlier if someone had just listened. We weren't anomalies. We were the norm. I started researching. I spent hours on my laptop between chemo sessions, reading studies, articles, reports, and the statistics made me sick all over again. Black women are 40% more likely to die from breast cancer than white women, even though we get it at about the same rate. Why? Because we're diagnosed later and treated less aggressively. Black women are twice as likely to die from pregnancy-related complications than white women. Why? Because doctors don't take our pain seriously. Black women's pain is routinely undertreated compared to white women. Studies show that doctors literally believe we feel less pain, that we have a higher pain tolerance, that we're exaggerating our symptoms. It's not just individual doctors being racist. It's the entire medical system. It's the way we're taught to view Black women. It's the stereotypes. The strong Black woman who can handle anything. The angry Black woman who's just being difficult. The drug-seeking patient who's just trying to get pills. These stereotypes kill us, literally. I finished my last round of chemo in December. 6 months after my surgery, 6 months of hell. But I was cancer-free. No evidence of disease. The doctors said I'd need regular checkups, CT scans every few months, constant monitoring. But I'd survived. Most people would have just been grateful to be alive and moved on. But I couldn't. I kept thinking about those 2 women in the chemo center. I kept thinking about all the Black women who didn't survive because nobody listened to them. So, I decided to do something about it. I contacted a lawyer, a Black woman named Patricia Johnson, who specialized in medical malpractice. I told her my story. She listened, really listened, in a way that doctors never did. "Do you want to sue?" she asked. "Yes," I said, "but not just for me. I want this to mean something." Patricia took my case. We sued the hospital system, not just for malpractice, but for discriminatory medical care. We documented every visit, every dismissal, every time a doctor treated me like I was exaggerating. We filed the lawsuit in March, exactly 1 year after my first ER visit. The hospital tried to settle quietly. They didn't want this going public. They didn't want the bad press. But I refused to settle. I wanted a trial. I wanted people to hear what happened. I wanted other Black women to know they weren't alone. The trial took 8 months. It was exhausting. I had to relive every moment of pain, every humiliation, every dismissal. The hospital's lawyers tried to paint me as a difficult patient, someone who didn't follow instructions, someone with a history of anxiety. But we had the evidence. We had the medical records showing how long I'd been complaining. We had the CT scan showing a mass that should have been found months earlier. We had expert witnesses, including Dr. Freeman. Who testified about the racial disparities in healthcare? And we won. The jury awarded me $2.3 million. Not just for the medical malpractice, but for pain and suffering, for the discrimination I experienced, for the stage of cancer I ended up with because doctors didn't believe me. But more important than the money was what came next. As part of the settlement, the hospital had to implement new protocols. Mandatory implicit bias training for all ER doctors and staff. New guidelines for taking patient complaints seriously, especially when it comes to pain. A patient advocacy program specifically for women of color. It wasn't enough. It's never enough, but it was a start. I used the settlement money to start a nonprofit, the Black Women's Health Advocacy Coalition. We focus on education, helping Black women understand their rights as patients, teaching them how to advocate for themselves, providing resources when they're not being heard by their doctors. We also work directly with hospitals and medical schools, training the next generation of doctors about racial bias in healthcare. We bring in Black women to tell their stories. We show them the statistics. We make them confront the uncomfortable truth that their implicit biases can kill people. I'm 60 years old now. It's been 1.5 years since my diagnosis. I'm still cancer-free. I go for my scans every 3 months, and every time, I hold my breath until I get the results. The fear never completely goes away. But I'm alive, and I'm using my second chance to make sure what happened to me doesn't happen to other women. I speak at hospitals, at medical schools, at community centers. I tell my story over and over again. Some people listen, some people don't, but every time I speak, at least one Black woman comes up to me afterward and says, "Thank you. That happened to me too." And that's why I keep doing it. Because it's not just about me. It's about every Black woman who's been told her pain doesn't matter. Every Black woman who's been called dramatic or difficult or drug-seeking when she's actually dying. Every Black woman who's learned to suffer in silence because speaking up doesn't help anyway. We deserve better. We deserve to be believed. We deserve to have our pain taken seriously. We deserve to live. 3 months ago, I got a letter from a young Black woman in Atlanta. She said she'd watched a video of me speaking at a conference. She said she'd been experiencing severe headaches for months, and her doctor kept telling her it was just stress and to try meditation. But after hearing my story, she went to a different doctor. She insisted on an MRI. They found a brain tumor. Small, caught early, treatable. She thanked me for saving her life. I cried when I read that letter, because that's what this is all about. Saving lives. Making sure Black women know that their pain is real, their voices matter, and they have the right to demand better care. The medical system failed me. It continues to fail Black women every single day. But we're fighting back. We're speaking up. We're refusing to be dismissed anymore. If you're a Black woman and you're in pain, I need you to hear me. Your pain is real. You're not exaggerating. You're not being dramatic. You know your body better than any doctor. And if something feels wrong, keep pushing until someone listens. Don't let them send you home with Tylenol when you need real help. Don't let them make you feel crazy for advocating for yourself. Don't let them silence you. Bring someone with you to appointments. A friend, a family member, anyone who can back you up and witness what's happening. Write down your symptoms. Keep a pain journal. Document everything. And if one doctor won't listen, find another one. Keep going until someone takes you seriously. Your life might depend on it. Mine did. I shouldn't have had to fight so hard to be heard. No woman should. But until the system changes, we have to be our own advocates. We have to be strong, not because we want to be, but because we have to be. They said I was exaggerating my pain, but I wasn't. The pain was real. The cancer was real. The discrimination was real. And my survival, my victory, my mission to change this broken system, that's real too. I'm still here. I'm still fighting. And I'm never going to stop until every Black woman who walks into a hospital is treated with the respect, dignity, and medical care she deserves. They tried to ignore me. They tried to dismiss me. They almost killed me. But I'm still here. And I'm making sure my story, and the stories of all the women like me, are too loud to ignore anymore.